Top tips for skin cancer surgery on the face. So I suppose it's always important to get the whole lesion. It's terrible when you cut something off and you get a response back saying incomplete margins. So to avoid that or to minimize that risk, one of the first assessments I always make is, do I think the lesion is well circumscribed, I can see the edges, or do I think the lesion is poorly circumscribed? And if it's the latter, I refer, often to Mohs surgeons. So if there's something where I'm not comfortable that I can see all the edges, then I refer off. That's important. I don't want to be doing those sorts of cases. Now, to make that assessment, it is clinical and dermoscopy. So sometimes I feel a little bit vague clinically, but then with dermoscopy as well, I feel more comfortable. Okay, that's where the edge of the tumour is. I can make a margin around that, and I'm likely to get the whole lesion. Another issue for skin cancer surgery on the face is understanding the natural lines and using those boundaries between cosmetic units. That sometimes means actually making a bigger hole than you plan to. And a good example of that is on the forehead. So sometimes you can close a lesion on the forehead with a straight ellipse, but other times you do need a flap to close the defect. And probably the most common flap I would use in the forehead would be an H-plasty. Now the trick there that I found is sometimes the vertical height of the lesion I excise is larger than the surgical margin that I need, so that my scar for the H-plasty fits into the person's natural wrinkles. If I follow their natural wrinkle line, what I'm finding is that at the 2, 5 and 10 year mark, the scar is less visible. And the person has the scar for life, not just for Christmas. And it is an issue where they've got to live with that for life. They always see that scar for life. If I can do a better job of hiding that scar in a natural line, they don't notice it, their friends don't notice it, and it certainly gets a better outcome for everybody. Another tip for surgery on the face is to make sure you're not distorting tissues. So the main areas there, of course, are around the eyelid, and particularly the lower eyelid, and causing some degree of ectropium, around the nostril, and distorting the shape of the nostril, and of course around the corner of the mouth. The ear is relevant as well, but ears are less visible to people in a day-to-day way. So central face around the eyes, the nostril, and the mouth, making sure your scar design doesn't cause tension on those areas. And again, that could be something that looks like a small, simple excision, but then it's going to cause some distortion, and sometimes a flap to change the tension will get a better outcome as a consequence.